Hi, I'm Dan Sosnoski, the editor of Chiropractic Economics magazine. We're here at Parker Seminars, Las Vegas, 2018. And we're happy to have with us Dr. Robert Silverman. He's a longtime contributor to Chiropractic Economics, and he's a known expert on low-level laser therapy. And we asked him to just share some of his ideas with us today. So first, welcome, Dr. Silverman.
It's a pleasure to be here.
Pleasure to have you. Okay. First off, I'd just like to say you use LLT in your therapy, in your treatment in your clinics quite a bit. What kind of conditions do you treat? What kind of patients can you help with a therapy laser?
Well, I do use LLT, so it's low-level laser. I like to define it as non-thermal.
Yes.
And the conditions that I treat are all the musculoskeletal, the abundance of musculoskeletal injury from neck to lower back, rotator cuff, ankle, knee, and some of the bigger things are some of the head traumas now. That's really something that I've gone into a lot, and that is sort of the new black box, if you will.
Yes. Yeah, and in the articles that we've published, some in collaboration with you, some with other, so they're calling it really now photobiomodulation.
Yes.
The light penetrates deep into the body, it stimulates the mitochondria.
Yes.
And it increases cellular activity, ATP production. There's a whole cascade of anti-inflammatory effects and the promotion of healing. So this is something that we keep keeping an eye on, and we're reporting as much as we can on this topic. So if a doctor's in the marketplace for a therapy laser, what are some of the features that a clinical grade laser should have?
Well, that's a great question, because there's a lot of laser companies out there. Everybody's got their place. But what I look for in a laser is, number one, I look for FDA clearances. I'm big on that. I feel much more secure with an FDA clearance. Number two, I like the non-thermal. And the reason I like the non-thermal is because there's no deleterious effect with the non-thermal. No glasses are needed.
Yeah.
In addition, with the FDA clearance and the non-thermal, what I really like is the wavelength. And I'm a specific wavelength guy of 635, which is visible light. So again, that visible light, you did a great job of Einstein's law of physics, photobiomodulation. It's the chromaflores in the cell membrane that absorbs the light, that allows ATP oxygenation and neurotransmission. So I'm looking for FDA clearance, wavelength, and we call it low level because the power, it's milliwatts. We don't need a lot of power. It's all about absorption. And I think that's where chiropractors get confused. It's like, well, it's stronger. That means it's going to pierce deeper. It's all about absorption. Think of the idea, a great example is a baby's born yellow. Bilirubin is released.
Okay.
So neonatal jaundice, as we call it.
Yes.
And what do? For thousands of years, we've taken them and put them in the sunlight, and almost instantaneously the bilirubin is gone because the light pierces the skin. How deep is that sunlight? It's not that deep, but it's absorbable. So we try and mimic that in a low-level laser setting.
Interesting. Very good. And you mentioned education. This obviously is something where you might want to take some preparatory steps before jumping into the modality. For any doctors out there who are interested in getting started, what are some first steps, or how should they approach adding this modality to practice?
Well, I'm a big proponent of always reaching out, going to seminars. Read. Your periodical is fabulous in that you put a lot of information from diverse companies and diverse fields to really ascertain and look and see what the leading edge material is, and I do appreciate that. It's very valuable, especially in the chiropractic market. We more and more have to adhere to science and verbalize and get that message out, because if we don't define what we do, somebody else will, and sometimes that doesn't work to our advantage.
You don't like the way they do it,
Yeah, I'm not happy with the way they're doing it. That's why we're here right now, and I appreciate the work you do. So, as you know, I work for Arconia, so I'm big on seminars. I believe come to a seminar, see what it does, look at the literature, look at the hands-on, because we're still a treatment-oriented field. So when you can see the outcomes before your eyes, that's, once you see the information and you can see it before your eyes, that's going to be more than just evocative. That's going to be tangible.
Okay. Well, that was a nice overview of the field and your work, and we hope to feature you again in the pages of the magazine.
I look forward to the next contribution. Everybody, I hope to see you soon. Stay with Chiropractic Economics. Appreciate your time.